Emergency calls related to mental health issues are usually dealt with by police, and it has become very clear that is not the most appropriate response. A pilot project sponsored by the Canadian Mental Health Association to address that issue is currently underway. It involves the formation of peer-assisted crisis teams, and the City of New Westminster is an active participant. Johnny Morris is the CEO of the BC division of the Canadian Mental Health Association and is our guest on this edition of Talk New West. Welcome to Talk New West.
Well, thanks so much for having me with you on your show, Kurt.
Now, as I understand it, individuals suffering mental health crisis or who pose a danger to themselves or to others are often dealt with by police. Why isn't that working?
Well, maybe I'll just start quickly with saying a bit about how we've gotten to this point in time. So we have arrived at a point in time where increasing numbers of mental health emergencies are being responded to by police. And there's a lot of reasons for that. Access to mental health services, people being in crisis, but also some of the built-in stigma that exists that leads to the belief system that people living with mental illness are violent, which they are not, and police being the response. So we've kind of arrived at this place where police have become the de facto mental health response service. And what we have been saying for a number of time is, firstly, we need to find ways to ensure that when people are experiencing a health emergency or a mental health emergency, that we send as much of a health response as possible. When police come and they may have good training, they may have good experience, good expertise, for the person who's on the receiving end, it can absolutely create fear, it can create worry, it can rapidly escalate things. And I think we've seen a number of very, very tragic outcomes, whether they be injury or fatality, when police are the only responder to a dynamic or a volatile situation. So we're trying to course correct that with this work, and we are enjoying the support of police in finding a new path forward, Curtis.
Okay, so now the Canadian Mental Health Association has initiated this pilot project, which is the peer-assisted crisis teams. Who are the partners in this, and how is it going to be different?
For sure. So we are a provincial organization at the Canadian Mental Health Association, and so we are kind of have taken up a policy position, an advocacy position on adding to the range of responses that exist in communities. We've seen huge interest at the City of New Westminster in adding to that range of support. So a key partner here is the City of New Westminster, the municipality. So both elected officials and city staff have walked alongside us in charting out a proposal, securing some initial resources, and mapping out a process where the community comes to design this. Some of our other partners do include community organizations. Just today, actually, we met with a number of community organizations to kind of chart out the process of designing this team going forward. But we also have other key partners. I'd say that the US Police Department have signaled support and interest in this work at the chief level. We have some early conversations with ECOM, which is the kind of the machinery of dispatch behind the scenes. And we've got some good ongoing and early conversations with other key actors like the health system, Fraser Health Authority, for example. We are also very, very keen to find ways to ensure lived experience as part of this. So partnering with people who have experienced crisis or the system itself, and really building relational, meaningful relationships with Indigenous communities. So First Nations, Inuit, Métis, Indigenous community members who can also co-lead this work going forward in a really meaningful way, Curtis.
Now, what would a team look like? Or have we got that far?
Well, we actually have a team that's launched on the North Shore, so North Vancouver. There's a team that the CMHA Northwest Vancouver branch have launched. They've been in operation since November. They've taken in excess of 100 calls, and they are really the proof of concept of what these teams look like. So they have a peer, and a peer is someone who has received training and knowledge and skills, but who also has lived experience, whether that be of a mental health or a substance use problem, and of the system potentially. And they're paired up with a mental health professional. And that could be a counselor, a social worker, someone with training and expertise in mental health care. And so these teams, it's a civilian team, they go out and respond to a situation involving distress or crisis in the community. The North Shore implementation, there's a phone number directly into the CMHA, and the team gets sent from the branch itself. There are other ways to do that. But typically it's that pairing, a peer alongside a mental health professional to go out and respond to situations.
Now, you mentioned the new West Police Department. So what role do the police still have a role in this, or are they advisory?
Yeah. Well, when we think about crisis care and community, I often think about a toolbox, and at the one end are police alone responding, which in some communities that's the reality. That's the 24/7 service that exists. Mm-hmm. In some communities, there's what's known as a co-response model, police going out with a health worker or a civilian to respond. And then we're kind of at that level where it's civilian only. We're of the position that police play a role, a critical role in so many ways as first responders. And we believe that there's a need to be good partners with police in thinking these things through. So in the context of New West, we have a strong sense of support there, a sense that there are better resources and better responses for particular kinds of circumstances. And arguably, there could be situations where a police attendance or a police response is required for a number of reasons, including safety. So we believe in making that toolbox as big and as expansive as possible. And police, also the ambulance service, fire, first responders writ large are a key part of both the design and ultimately thinking through how the system includes them, going forward with this kind of response, Curtis. So we're very, very grateful for the support and insights that we've heard from the US Police Department and look forward to working with them as we continue forward.
I'm just trying to see how this would work. So it seems to me that if there is somebody suffering from a mental health crisis, probably there would be a call, like a 911 call or something like that. How does it go from that to the crisis team?
Well, some of that detail still has to be worked out, Kurt, in the sense of thinking through the conundrum of dispatch, right? We recognize that for some people, they don't want to call 911 when they're in distress or crisis. Maybe they've tried before and they didn't have as good of an experience as necessary. So we know that there are some that will. For others, calling 911 is what we've all been trained to do since we were little, to call for help. And so there's a whole proportion of people who access emergency resources through 911. There's a really active conversation around if you were to call 911, are there more options that could be provided beyond police, fire, and ambulance? And we are not there yet, to be very, very clear. Mm-hmm. But there's a very important conversation around, could that system also be part of sending mental health responses out directly, perhaps with linkages into really key services like the crisis line network? Mm-hmm. The North Shore implementation rather is seeing, some real good success with kind of directly calling into a phone number that is attached to the CMHA, the Canadian Mental Health Association there, and getting care directly. So this is why we've got these processes or planning processes in the way to really make sure that we have a system where people don't get lost, they get the right care at the right time, that there's coordination and linking up. And there are a few options, I think, on the table, and I think a strong desire amongst a number of partners to be innovative and think things through differently around how we send help to people experiencing a crisis.
Now, is there, what about budget and funding?
Well, we are in pilot phasing. So in New West right now, we have the resources required to design it. Of course, there's the question of resources about a team getting funded. So there's a couple of unanswered questions there. So if we get through this phase and we're successful in securing money to kind of run the pilot, what we really want to do is prove out, like they're doing on the North Shore, that the concept works. You know, when you think about it, on the North Shore, they've taken over 100 calls, I think 150 when I last checked since November. They've only had to involve the police once. So they've done a huge amount of diversion from police needing to call, which come with a dollar amount every time they attend. And they've also been able to keep or find ways to keep people safe without needing to go to the emergency department. So in both those areas, there's actually a business case there's more to it than the business case, but when you boil it down to the economics, they're proving out a return on investment there on the North Shore. We anticipate the same would happen in US. So in some ways, it starts to pay for itself in some ways. But ultimately, you know, our current approach is seeking support from municipal and the provincial government to try this out for size. And I think we'll get to the point, if we can prove continued success, of how this might attract some dedicated funding to keep it going. Of interest, the City of Toronto, with support from the provincial government in Ontario, have just launched 4 teams with very strong municipal support at the City of Toronto, money flowing through the province, the city taking ownership of it. And then that's another case study that we can look to for success, the return on investment, and most importantly, Kurt, people having a better experience of care when it comes to a mental health emergency.
So where are we? It's a pilot project. How far along is the process?
So in New Westminster, we are at a stage of the council has done a fantastic job in creating a kind of a working group with elected officials, councillors there who are providing some direction, guidance, and oversight. We've got city staff involvement. We've got some resources secured. We at the provincial level are now embarking on what we're calling this design planning phase. So we've just as of today met this lovely group of community organizations, and they've helped point us to who's missing from that table. We've got some work underway with the system side, so police, fire, e-com, health. And we anticipate this design process to be done well to take place over the next few months, the next 2 to 3 months. And then what we hope to be is that we'll have a report with some recommendations and some guidance around what this team will look like so it fits for New West. And we'll look at hopefully having secured investment there for a team to operate. And we would procure a team and take it from there, Kurt, and see how it goes moving forward. So we're at a very early stage, but I would say an early stage with some really strong interest, momentum, support. I'm incredibly grateful for the role that the city's playing here, elected officials and staff, folks like the chief of police, and also the community sector organizations who I think really want to see this added to that toolbox of care in the community.
Well, I think it sounds like a long overdue, progressive, and really interesting proposal. And I want to thank you very much for coming on Talk New West and filling in some of the details.
Thanks so much for your excellent questions, your care, and your interest, Kurt. Thank you very much indeed.
Okay, well, thank you very much, and bye now.
Bye-bye.